So my name is Lydia Akumu. I'm a doctor currently doing my master's in obstetrics and gynecology. I work at Kenyatta National Hospital, which is the largest referral hospital in Kenya. I think back at home, we tend to focus more on the research as opposed to actually applying the evidence in helping the outcomes of our patients. The fact that I was going to learn about evidence, implementation of research, and could actually get an opportunity to implement this back at home where I work. So the first thing I did was to form a team, because I needed to involve members of our department together with members of the managerial team of Kenyatta National Hospital to explain to them what I was about to do and see how they would receive this. So I was looking at the assessment and management of women with heavy menstrual bleeding, and this was important to me because we tend to focus more on the issues that affect the pregnant woman. We have protocols, we have mortality meetings when an incident occurs, and somehow we ignore the issues that affect the non-pregnant women. This is mostly heavy menstrual bleeding or issues around menstruation. Most of them suffer in silence, and yet if they could talk about this, they could actually get help. It's unfortunate that in some parts of our country, there are people who are not able to access the normal pads that women use for menstruation. So you can imagine if someone has heavy menstrual bleeding and they are not able to access it, what this does to their self-esteem, to looking at them as a person, and to the end effect, the quality of life they have. Biggest problem is iron deficiency anemia. And once you're anemic, it affects your quality of life. Some of them don't even go to work because of the anemia and the pain associated with it, and sometimes the embarrassment. The major impact we had, in my opinion, was in the education of these women, in helping them accept that this is a condition like any other, and the management options that are there could actually improve their quality of life. First, we had to educate the clinicians themselves on the available protocols. Secondly, we put up all these protocols in the hospital. And the other thing we did is educate these women on their condition and the management options. The best thing was actually getting to implement what I came here to learn, knowing that we can use the resources that we have that we've not been using, because we didn't really go out of our way. We just implemented what we had and we were not using. Then after that, the patient outcome, the satisfaction was the best thing for me. First, the exposure, the opportunity to come here and learn and actually get back home and implement what already exists. JBI program taught me how to use the resources that we already have, implemented them into helping our patients. So we already had these resources, but we didn't know how to implement this. And that is what the JBI program taught me.